And next up, we have a presentation from Alisa Brownlee, who is going to share with us the ALS Association's Rapid Access Communication Kit distributor, I can't say that word, program, distribution program.
It is lovely to be here and see everyone live. And I'm going to follow a few of the speakers who gave a fun fact about themselves. Well, here's my fun fact. 20 years ago, I attended the ALS Clinical Conference in Washington, D.C., and my husband and I bought a house that I had never seen. And apparently this week I bought a car that I've never seen. So I think fate is telling me to stay home. Okay. So thank you for this opportunity to speak about our rapid access communication kits. And I always start my lectures, and everyone in this room knows how powerful communication is. But this quote, and even though it's an old one, for the person who has spoken without difficulty since early childhood, the prospect of being unable to communicate through natural speech is incomprehensible. It's the one thing that people with ALS tell me they absolutely do not want to face. I'll take the wheelchair, I'll take the rollator, please don't tell me I'm not going to talk. And Janice Light, who is a PhD SLP at Penn State, describes communication as the essence of life. So the advantages and promises of augmentative communication or speech-generating devices for people with ALS, this is based on a paper by the authors listed. Psychological well-being, increased quality of life, social participation, reduced caregiver burden, and psychological assessment. When it comes to communication for people with ALS, I get all kinds of questions. What's the best? Well, there is no one right way. It is individual for every person. We do know through studies that 50% of people with ALS will become dysarthric. Whether or not that's mild, moderate, or severe, we don't know. 25% will become anarthric, the inability to produce any sound. So if you add up the top two numbers, that's 75, 80% or more of people that need some form of communication help. And another question I get asked all the time, well, what do most people do? Well, there's no one right answer. Some people will use electronic communication. Some people will not. But most people will use multiple modalities of communication. I've yet to see somebody in a bathroom sitting on a commode use their eye gaze. So we have to teach people strategies for where they are within their home and their community. And even with the most advanced eye gaze technology, there has to be a backup system in place. But first and foremost, you know, people who can't speak, the first thing people do is we'll write it down if they can still write. Does your client read? We have an illiteracy problem not only in the United States, but throughout the world. So according to the United States Center for Educational Statistics, 21% of adults in the United States, that's 43 million people, fall into the functional illiterate or illiterate category. World illiteracy is 773 million. My experience with people that have been illiterate, now I've been with the ALS Association for 27 years. Can you guys guess how many people have told me they can't read? That's a big fat zero, okay? So people take offense when I say, can you read? So I ask them, how well do you spell? And one of my clients who hadn't told me said, well, I don't spell really well at all. What does that mean? Well, my letters get all mixed up and I never got through school. Okay, that's important to know. But that is not something that he said before we're in the middle of an AAC assessment. So I always ask, how well do you read? And I thought this was an interesting study from Pew that 51% of people go to YouTube to learn something new. So if we want to teach people, if they're illiterate or if they have trouble reading, do a YouTube video. I probably get 1 or 2 emails a week from people who say, I saw you on YouTube using a letterboard, can you send me one? So I always send people to YouTube because majority of people are visual learners, so they need to see something. So rapid access communication, the communication kits I'm talking about. Why use the term rapid access? Well, because when I used to use low technology, people equate the word low with intelligence. And I'll get a caregiver telling me, they're not unintelligent, they're smart. And I'm like, no, low doesn't equate with your intelligence. So 6 or 7 years ago, our mental health nurse said, why don't we start using rapid access? I said, that's great terminology. And the infographic on the right was posted on Twitter by Assistive Wear last year, and I was tagged into it from one of my Twitter colleagues. And they, too, are stopping using the word low, and they call it light tech. And in the Twitter feed, some people called it paper-based technology or quick access. But I implore my fellow colleagues, please stop using the word low, because it will shut the conversation down. So reframe it, use a different word. And when I tell people, let's talk about quick access, it's something you can do in 30 seconds, they're like, really? Yes, it is. Sorry. So rapid access systems, what are they? I always have families establish a yes, no, and maybe system. This is imperative. And I tell them to put it on the wall so that if they had to call first responders, if the police came in, if a therapist that came in that's never seen the client before, what happens when they can't talk to the client or even know how to answer yes, no, maybe? They'll ignore them. All right, and it's always yes, no, maybe. My colleague Lisa stated this yesterday too. You have to give people a way out. So I've heard a lot of people say, oh, I use blinks. I don't preferably, that's not my preference, because I might miss their blink. I might be blinking, so I like to give them targets. Look this way for less, left for no, and up for maybe. We've established a system in 30 seconds. And always put that where people can see it. Other rapid access technologies are letterboards, picture boards, encoding. So I tell people to use encoding in the bathroom a lot, because that's where communication breakdowns happen. How many things do you have to say if you're sitting on a commode, truthfully? Number 1 is I need more time. Number 2 is I'm ready. Number 3 is I'm wiped. Number 4 is get me up. You put it on the wall, and the caregiver comes in. Do you have something to say? 1, 2, you need more time, or whatever. So we've solved that problem right away. You can use laser pointers as depicted in the middle with large poster boards, iLink boards, which are clear acrylic boards like this. I got this one on Amazon. But this does require a little more training than letterboards. But this is a directional eye gaze board. And then an ETRAM board, which is sort of the same thing. It has a hole in the middle for communication. So why would people use rapid access as a primary means of communication? One of the things that we've heard multiple people say this week is check your bias. And everyone check your bias in this electronic world, that not everybody wants to use an electronic communication device. And I have heartfelt conversations, especially with grandchildren, when the grandfather might be the person with ALS. And kids are born now, coming out, and their fingers move like this, and they can't fathom not using technology. But their granddad doesn't. So we need to educate them that not everything has to plug into the wall. But other reasons for rapid access as a primary means of communication could be cognitive issues, could be language issues like aphasia, could be your place of residence. Unfortunately, in this country, Medicare does not pay for electronic communication aids when you are in a nursing home. And as my colleagues here in 2010 pointed out, that rapid access systems are inexpensive, they're quickly attainable, they won't malfunction, and they're not a liability for people in nursing homes. They could be for emergent hospitalization, especially when regarding ventilation. I'm sure you've all worked with people who have ended up in the hospital, emergently vented, trached and vented, and they did not have a communication device prior to going to the hospital. So what are we going to do until we can get them home? Because, again, unfortunately in this country, you cannot get a communication device from Medicare if you reside in a hospital. So you have to be at your place of residence. It could be financial. Electronic communication aids they can be expensive. It may not be a covered item under somebody's private insurance. It might be an individual choice. control issues. You want your caregiver around you all times. And also, as end of life approaches, we tend to see electronic use go down and use of rapid access go up. And most of that is simply due to client fatigue. As a backup means of communication, say somebody does have a speech generating device. Well, we know that communication breakdowns happen in bed or in the bathroom. Most of the time that's because the communication device isn't there. We might use rapid access in the emergency room. As I mentioned, inpatient hospitalization and ALS center visits. How many of you have come, your client with ALS has come, and you go, where's your communication device? At home. Why? Because unfortunately, most insurances only pay for one mount, a wheelchair mount or a rolling mount. So the client might have opted for a rolling mount, as I pictured here, but those don't fit in cars. They barely fit in vans, so most people leave their communication device at home. And I will say, I can't remember which ALS clinic it was, but I was so impressed that, and I can't find my picture, but this clinic had a communication board on every door, the back of every door at the center, and I thought that was brilliant. Because what is someone going to do if you don't have a communication board right there? Although I hope, every ALS clinic does have them. And also, our rapid access can be a means of emergency preparedness. If you were here a few days ago, we had a speaker talk about evacuations, but also conflict zones. So you tend not to bring your communication device if, and we're in a state prone to wildfires, where you have to evacuate immediately. Yes, you might bring it, but you might not bring it. You might bring something else instead. So the ALS Association has rapid access kits, and these kits are available for free to anyone who asks. And it could be a person with ALS, their caregiver, a clinic, or any allied healthcare professional. So the clinic comes with cover letters. It comes with a compensatory handout that was written by the Mayo Clinic. It has two-sided letterboards, and two-sided because if it's only one-sided, I'm always looking down and up to see what indicator my person that I'm communicating with is. Whereas if I can hold it, I can say, is it row 1, 2, 3? They say yes, I, J, K, yes, okay. It also comes with eye gaze boards. Same premise, but you want the person to look at the red dot, and then the caregiver goes, okay, you're looking at 1. Is it A, B? Okay, B, we move on. Also comes with critical communicators. And these are both picture and English boards. They come in 18 different languages. If you need a communication kit that is not in one of these languages, what I tell people is take this kit and use it as a template and make your own. So communication breakdowns, what happens when people don't have access to a device? And again, referring to my colleague Alisa Brownlee yesterday in her abstract, her number 2 point was, when communication struggles exist, patient safety can be at risk. And that is absolutely true. And as you can see, based on the first study, communication breakdowns have long been cited as the root cause of every sentinel event reported by the Joint Commission. And a 2007 public policy paper focused on health literacy. The Joint Commission recommended that healthcare organizations make effective communication an organized priority to protect the safety of patients. So the ALS Association has a goal to make ALS livable by the year 2030. And we have 4 pillars in our strategy. And this program represents the 3rd pillar, prevent or delay harms associated with ALS. If we can give people a rapid means of communication, we can hopefully decrease risk. If you want to obtain a rapid access kit or more than one, you can ask for multiple. Our goal is to eventually put this in our ALS Association portal, but at the moment it's being housed in my office, so you send me an email. How many kits do you want? and give me a shipping address where to go. I do have an electronic version that I can send, but it will not include the critical communicator because that is a copyrighted piece. Also, if you need something immediately, patient-provider communication is a wonderful resource where you can pick the boards that you want, download them, and immediately start using them. And as you can see, they have boards for a variety of different areas, advanced directives, they have daily care, and bilingual boards. The contact information for me, my email, alisa.brownlee@als.org. And also, for healthcare professionals, we do have an assistive technology listserv. Should you want to join, you just need to send me an email. And I stay within my time frame. That never happens.
Fantastic. So, thank you so much for
sure.
that. Who says you can't kind of teach an old dog new tricks? I've just learnt 2 things today from you, so thank you.
You're welcome.
My first question was going to be, what about the bathroom when people can't communicate? But you've answered that with the encoding, and I think that's such a simple and brilliant idea. So thank you for that. And the other thing is that I often do, and big mistake, is I often have the yes and no, but I forgot the maybe. So again, thank you.
Sure.
Do we have any, there's a question in the middle there.
Hi. Marcela Santos from the ALS Association in Colombia. So in Colombia, we don't have eye gaze technology, so this is our form of communication with our pals and gals, and something we upgraded with the alphabetical board, the one that's transparent. We added a whiteboard at the bottom, and that way people with an eraser marker, they can write letter by letter, so the caregiver doesn't lose track of what the pulse is saying. Because we were talking about this earlier, the thing about that board is you're also testing the caregiver's capacities and abilities to keep track. And the patient knows what they're going to say, but if the caregiver gets distracted, they lose track. So we added that whiteboard, and it's been amazing because you can stop at the middle of a phrase, go to the bathroom, eat something, and then keep going with the rest of what you were going to say.
That's a great idea. Really good idea. And you're right, the caregiver does need to write things down if it's longer. The other thing I tell the person that's communicating, if you're changing the subject, give us some kind of symbol, okay? Because I've been like writing things down, I'm like, where are we now? Like what subject area are we in? So even if they can do something with their hand or their foot, just to let me know they're changing the subject. But that's a great idea. Thank you.
You see, we're learning lots today.
I'm Kat.
Hi.
Kat Cantor. I'm with the ALS Association in Wisconsin. And one of the questions I have is I feel like a lot of the time our rapid communication access is focused a lot on the medical or physical needs of people living with ALS. And has there been any research or work to include maybe like more of the mental, social, emotional pieces and cover more communication modalities than just kind of that meeting immediate medical
You mean
needs?
for rapid access?
Yeah.
Unless my colleagues, if my colleagues want to speak up, I did a deep dive on, and I did use the word low when I was on Google Scholar and PubMed, and there is relatively little research on easy access communication for people with ALS. It's all based on high-tech eye gaze. And so it's a little frustrating, but I was not successful unless somebody else knows.
I'm just looking, are there any more questions? Yes. Oh, Sarah has a question.
Oh, of course she does.
I love that, Lisa. I thought that was a fantastic presentation. I have a question in your rapid access one. Do you have bilingual, a bilingual form or sheet or whatever you call it?
Yeah, I have the instructions in Spanish, and I should mention, by the way, I did not mention, on the boards, the ones that were created. There's directions here, because it's not intuitive for some people to use. But I do have Spanish, and then I can put those, the critical communicators in those 18 languages that I listed there.
But is there one that has both English and Spanish on it, so that if I'm communicating with someone who doesn't speak English?
The critical communicator does.
Okay.
My boards do not. So,
So that's next.
yeah. In critical communicator, this says oxygen. And if this was in Spanish, it would have oxygen in English and oxygen in Spanish. Same with all the 18 other languages, whether or not it's Greek or whatever. So there's no communication breakdowns. But the boards that we created, no, we need some for translation services.
Maybe we can work together on that.
Yeah, okay.